So, with all this NHS mental health services stuff, I've been mostly discussing my own story since that's sort of the story that, well, is the point from which I have the most information to draw. I don't really know a hell of a lot about the details of anyone else's story having gone through NHS mental health services, but I think I can sort of begin drawing some conclusions about this. Since in mental health treatment in the UK, I think there's quite a significant and stark class divide. Um, anyone like my former friend Barney Goodall from school, who the public school cunt, right? Yeah. You don't get the schizoaffective disorder you get for free on the NHS like the POVs do, and like I did actually. You get mummy and daddy to pay for an expensive private psychiatrist to give you nice, socially acceptable, Stephen Fry approved and sanctioned bipolar disorder, and the SSRIs to treat it. Now, the NHS, they have no interest at all in diagnosing anything other than psychotic illnesses. They can maybe give you a bit of anxiety on the side as a sort of a second diagnosis, just to sort of, like placate someone, I guess, or to make something a bit more acceptable. But they're only interested in diagnosing psychotic illnesses. Everyone passing through NHS mental health services that I've ever encountered, I imagine, has the same diagnosis of psychosis. They all talk about taking antipsychotic medications, as opposed to SSRIs. I've never encountered anyone on an SSRI, having been under NHS mental health services. So the assumption here is that, they are explicitly seeking to diagnose psychosis or psychotic illnesses. The reason for this is they have a slew of psychiatric wards, inpatient psychiatric wards, or acute inpatient psychiatric wards, wherein a lot of people work and they would like to be kept open. You do not need admission to a psychiatric hospital, really, unless you're suffering from anything other than a psychotic illness. That's just the truth. People undergoing anxiety attacks and panic attacks, they don't really need admission. People undergoing manic episodes, I expect like most of them, including myself, when I presented myself to the police in East Anglia in 2015, like I was going for a manic episode and I calmed down in the station. They sectioned me anyway because I said a police officer tried to kill me. That's what the police would do, I'm afraid to say. Big class divides. I don't see anyone really getting better. You see the smirking pricks, these gross, like, frankly, reptilian scum beetle creatures. Big smiles on their faces, while plenty of their patients are killing themselves, probably due to the treatment they're receiving, and going around. And, they got huge smiles on those. They're pictures of perfect mental health. Cushy, nice salary, got the respect and blue lanyard of the NHS and all this. And, everything's, they're bloody wonderful, aren't they? And all this. And, taking, some of the most vulnerable young people from poorer communities in Britain, out on walking groups and badminton and all this nonsense. And everyone in those horrible walking groups just looks medicated. And none of them are getting better at all. That's what they want. They want to keep it in stasis to protect their jobs, to secure continued funding from central government for mental health services, particularly in a time of Tory austerity, because mental health services would be the first service the Tories would cut. And as they can perpetuate this image, or create this image of a mental health epidemic, right? Of psychotic illnesses, to necessitate psychiatric hospitals, to necessitate employing those staff, and they're trying to protect their jobs so they don't have to go clean toilets like they ought to be doing. And are they quite willing to let some, the vulnerable people from some of the poorer parts of the UK kill themselves? Yeah, of course they are. They don't care about that. They just want their salaries still, and their lives. They don't want to have to get a new job. They've got families to support. But, it's me and mine over you and yours, right? Let them kill themselves, doesn't matter. In fact, it just helps them, because it makes the epidemic worse. That's the reality of it. That is the reality of the situation. The NHS are torturing people. I've been tortured by them. Yeah, really tortured by them. In my case, like the corruption like serves a somewhat different end to what it does in most people's cases, I imagine. But then again, who knows? There may be all sorts of things like these people have witnessed something they shouldn't have witnessed, or they're otherwise, they otherwise have an inconvenient message about the system that they want to put out into the world. So it helps the system, frankly, to portray them as psychotic because no one believes them then, or they're robbed of credibility. So that's another element to it. But yeah, I mean, it's very rarely kind of like one factor. There's usually a constellation of factors, I think, that builds enough support or generates enough interest in a certain move in terms of policy that allows these sorts of things to happen. But yeah, like I said it before, like mental health services, like you talk to ordinary people, the ever to access NHS mental health services, you don't want to access NHS mental health services at all. Like that's so we were forced to go private to help with my OCD, which because you went private, probably got accurately diagnosed, right? Because the NHS is too busy just like rounding up, the mentally ill among the poorest, torturing them, and keeping them unwell, deliberately just so they can keep getting money and like keep the merry-go-round going. Like lots of them kill themselves. Their services are dreadful, and the diagnosis is arbitrary, the detention is arbitrary. You get treated with coercion. They'll force medication on you with the threat of hospitalisation, with the threat of being sectioned. And they'll lie and make everything up about all sorts of things or twist things. It's horrible, just to like keep the hospitals full, keep people employed. Because if the stats go down, like the central government will notice, they'll get axed. All their jobs are on the line. It should be fucking private. It should be subsidised private mental health treatment. No NHS mental health services at all. Except like maybe the really secure units like Broadmoors and so on. We should keep those open. But probably make them way more humane. And frankly, very few people have any good idea what actually goes on inside places like that. And I'd like to find out, but that's a topic for another video. Yeah, that's my critique of NHS mental health services. I have a lot more to say, but yeah.